Vascular dementia is the second most common form of dementia. I think it's a phrase you're going to hear a lot more frequently in the future. In reality, most dementia is sort of a mixed bag of Alzheimer's, Parkinson's, and of course vascular dementia. Dr. Greger at nutritionfacts.org is going to be doing a video on vascular dementia. Some of his past videos on Parkinson's and Alzheimer's relative to nutrition are very fascinating. Vascular dementia is a late stage symptom of coronary artery disease. Of course, coronary artery disease for most people starts in childhood, even before the age of 10, due to the significant consumption of meat, dairy, and egg food products. We now know, of course, that atherosclerosis, coronary artery disease, is preventable with the right lifestyle changes. Vascular dementia is forgetting what day it is, then which week, which month, which year, ultimately which decade. As this disease progresses, people tend to become lethargic, overweight, and see vision declines. High cholesterol, high blood pressure, late onset diabetes, these are strong early warning signs for vascular dementia. The more medications a person is on for any number of preventable symptoms, the higher the risk for things evolving to vascular dementia. Vascular dementia is ugly and messy. Vascular dementia is forgetting to put on undergarments and letting the bladder and bowels loose before even getting to the bathroom. When doctors diagnose Alzheimer's, Parkinson's, vascular dementia, they're looking at evidence from CAT scans, MRIs, neuropsychology testing, medical records, general observation. And while the science is pretty fascinating, biochemistry infinitely complex, in reality, the diseases are all very similar. The end result is the same. From a practical standpoint, do we really care about the exact diagnosis? With these labels and dopamine levels and lesions and so forth come different medications, different treatments, but what's usually ignored is that a whole foods, plant-based diet can typically prevent or even stall the progression of all of these diseases. The bottom line is that poor blood flow results in a lack of oxygen and nutrients to the brain, and this causes a significant increase in poor judgment for the patient. With vascular dementia, symptoms are caused by major strokes, mini strokes, and small vessel disease deep within the brain. Vascular dementia is making it impossible to remember the answers to the questions asked 30 seconds ago, making it nearly impossible to follow the news or TV shows or to even read. Vision problems are typically associated with vascular dementia for a couple of reasons. Number one, the capillaries in our eyes are amongst the very smallest in our bodies, so atherosclerosis is going to impact the health of the eye. And as parts of the brain are impacted from low blood flow, partial fields of vision can be blocked or compromised due to what's going on deep in the brain. Life expectancy after an Alzheimer's diagnosis is 8 to 12 years, while with a vascular dementia diagnosis, life expectancy is 3 to 30 years. With vascular dementia, the decline is it's more of a stair-step downward spiral, and it seems to be more related to stroke activity. So losing people to this is kind of like watching them die in bits and pieces very slowly. Vascular dementia is a slow death to a sense of humor. A single case of dementia obviously impacts many lives. Many assisted living facilities have people waiting in line to get into the dementia units. Vascular dementia is similar to alcoholism or drug abuse in that as it advances, they stop caring about others and themselves. Obviously, providing 24-hour care to dementia patients is not practical or safe for most family members. Vascular dementia is losing what makes you you. You lose your money, you lose your independence, you lose your memories. We know that vascular dementia patients can stop the disease for a long period of time or slow it way down. But can vascular dementia actually be reversed? Well, we absolutely know that a whole foods, all plant-based diet, a lower fat plant-based diet, can actually reverse coronary artery disease. And we know that the human body is essentially self-healing under the right conditions, and that every cell in our body, virtually every cell, is replaced within about 7 years or less. So that means we have a new vascular system, a new heart, a new brain. So since we know that blood flow and oxygen, nutrients can be, the flow can be restored to the brain, can new brain cells come online essentially that can improve memory function for advanced vascular dementia? I don't know. I'm an optimist.